Rahim. Assalamu alaikum. My name is Dr. Uzair Ahmed, and today's lecture is uh, intended for third year BDS. We are done with different parts of a cast partial denture. Now we are going to start the treatment planning phase and the treatment execution phase of providing cast partial denture treatment to the patients. Now the first and foremost you can say step of treatment planning is after recording of impressions and pouring the cast, we get what do they call is the diagnostic casts. Now when you have diagnostic cast, then the first step of after acquiring diagnostic cast is surveying the diagnostic cast. Now this is one of the preliminary and very important steps of cast partial denture fabrication. Surveying is done with the help of a dental surveyor, which is an instrument that is used to determine the relative parallelism of two or more surfaces of the teeth or other parts of the cast of a dental arch. Now, as we go further, we will understand the meaning of this definition. There are two types of dental surveyors, Ney and Jelenko. These are the basic, you can say, classifications. There may be other types of dental surveyors also. This is what they call is Ney. Um, Surveyor. The parts of a surveyor, regardless of its type, either it's a Ney surveyor or a Jelenko surveyor, is uh, some of the integral parts is the platform on which the base is moved. Vertical arm, basically platform over which the dental cast is placed. Vertical arm, it supports, this is the vertical arm, it supports the superstructure. This hole is superstructure. Horizontal arm is this, and this also, which is vertical, is called surveying arm. And its surveying arm, it carries the mandrel, which actually carries different types of surveying instruments. Locking device, is all these locking devices are also present to record, or you can say to fixate the surveyor in a specific position. Surveying hose, instruments and cast holders as well. Moving on, uh, what are the different functions, or you can say purpose of using this instrument? First of all is surveying the diagnostic cast, as I was talking about. At this point of time, as a third year BDS students, you have to understand the specific terms that we use during dental communications. Diagnostic cast is that cast which is recorded or which is taken at the initial appointment of the patient, when the patient reports to you uh, and wants his or her treatment. You record his or her impressions, and that is called the diagnostic cast. And surveying the diagnostic cast whenever planning for cast for denture is mandatory. And different purposes of surveying the diagnostic cast is to determine the most desirable path of placement that will eliminate or minimize interferences to placement and removal of the denture. And path of placement and removal are always the same but in opposite direction, and whole movement is made possible because of guiding influence of tooth surface is made parallel to that path of placement. Basically, we know that path of placement, the denture should not move in any other direction other than that of path of placement and removal, because this requires the, which we call the ability of a denture to retain its place or to have a adequate retention. Path of insertion is basically that part which is followed by prosthesis from its first contact with the teeth until they are fully seated. This path coincides with the path of withdrawal and may or may not coincide with path of displacement. There may be a single path or multiple paths. Multiple paths exist, for example, where the abutments are divergent. or when point contacts between the saddle of the denture and the abutment teeth. Um, Here we see that the in order to seat this denture, we are feeling some type of resistance over these and over these abutment teeth. Path of displacement is the direction in which the prosthesis tend to be displaced or dislodged from its position during function. As a path of insertion, this path is variable but is assumed for the purpose of design to be at right angles to the occlusal plane. To identify proximal tooth surfaces that are or need to be made parallel, so they act as guiding planes during placement and removal of denture. Now you see that when we survey with the help of dental surveyor, we can understand that these walls need to be changed, modified in order for this denture to insert properly. Excuse me. So here we made these two walls parallel to path of placement. Also, another purpose is to locate and measure areas of teeth to be used for retention. Now this is the point. Here we can see that this is the surveying tool and it is showing a prop in a specific position of a cast, and we can see that over a tooth there is height of contour, there is supra bulge area and infra bulge area which is clearly visible. We can easily locate the clasp retentive arm of the clasp, because retentive arm has to be placed in the infra bulge area. So this is another purpose of the surveyor. Also, another purpose is to determine whether teeth or bony tissue areas of interference will need to be eliminated surgically or by selection of different path of placement. To permit most suitable path of placement that will permit retainers and artificial teeth to provide best aesthetic results. Here you can see so many different abutments are involved in construction of a denture. So how will we know that the path of insertion that is that requires that is least, you can say, interfered by the abutments? This is only made possible with the help of surveyor. Also, to permit accurate charting of the mouth preparations to be made. Here with the help of surveyor, they have marked that this area of the tooth has to be modified, this area has to be built, all like this. Also to delineate the height of contour and abutment teeth and to locate areas of undesirable tooth undercut that are to be avoided, eliminated or blocked out. This is the I hope that you guys identify this, that with the help of a carbon surveyor, carbon marker, this is the height of contour of the tooth. This is the infrabulge area, this is the suprabulge area. To record the cast position in relation to the selected path of placement for future references. This is also called the tripoding. Tripoding is the after selecting a specific cast for its path of insertion and removal, 3 points are made with the surveying tool in different positions, so that whenever that cast is reused on the surveyor, we make these 3 points touch the surveyor tool, and by that we will know for sure that this is the same position that was used before. This, you can see that this mark and this mark all need to be touched at the same time by the surveyor, and this will automatically orient this cast in that particular direction. Now after diagnostic cast, if you know that sometimes we have to do wax work over the cast, over the dental cast. So contouring of wax pattern is also one of the uses of dental survey. This, here you can see that this is the abutment crown, and to make this wall parallel to the path of placement, surveying tool is used to make this area parallel, and then it will be fabricated in lost wax technique, and by that way this wall will be parallel to the path of placement. This is the trimming of the wax. This is the formation of a wax crown. After final contouring, this crown will be fabricated in metal and ceramic. Surveyor blade is used as a wax carver, and guiding planes on all proximal surfaces of wax pattern adjacent to the edentulous areas should be made parallel to the previously determined path of placement. All other tooth surfaces that will be contacted by rigid corners should be made parallel. Also, surfaces of restorations on which reciprocal and stabilizing components will be placed should be contoured to permit their location well below occlusal surfaces and non-retentive areas. This, you are familiar with this, that the reciprocal arm lies over the height of contour, and retentive arm, the terminal end of the retentive arm, lies below the height of contour. Also, another purpose of surveyor is surveying ceramic veneers crowns. Now, after the same crown has been fabricated and a porcelain has been applied, the final wall or the surface of the tooth to be made parallel to the denture is then again made parallel with the help of a surveyor before inserting into the patient's mouth. Surveying is done to contour all areas of wax pattern for the veneer crown except buccal surfaces. Buccal surfaces, because buccal surfaces there will be final application of porcelain. Before final glazing, the abutment crowns are returned to the surveyor to ensure the correct contour of the veneer position, and final glaze is done after all the contouring is done. Another purpose of surveyor is placement of intracoronal retainers, which we know that they are aesthetic replacements of extracoronal retainers. They are semi-precision and precision attachments which are used to enhance retention and resistance. Surveying is done to cut recess in the stone teeth on the diagnostic cast for estimating proximity of the recess to the pulp, and to also to fabricate the fabrication of metal or resin jigs to guide preparations of the recesses in mouth, to place keyway portion of the attachment in casting before investing in soldering, and to carve recesses in wax patterns to place internal attachments. Excuse me. Placement of internal rest seats is also used with made possible with the help of a surveyor. Internal rest seat is a type of a rest seat which is placed inside, which is also intracoronal in nature, and it is placed within the bounds of the abutment tooth. This is the internal occlusal rest. It is a tooth supported partial denture, can use these rests, and this is not an internal attachment. Occlusal support is derived from floor of the rest seat and from additional occlusal bevel if better. Another purpose of using surveyor is machining the cast restorations. These cast restorations, which are fully made in metal, there is no porcelain over there. Then after final formation, their walls can be made parallel to each other with handpiece, because surveying tools, you have seen that different types of surveying tools can be used over a surveyor. Either it can be a carbon marker, a metal portion, a carbide bar, or a handpiece, a straight handpiece, which can also be used with the help of along with cylindrical carborundum point. Surveying the master cast. Now you have to understand that there was a diagnostic cast and then there is the master cast. Master cast is obtained after you have done all the mouth preparations in patient's mouth. All the diagnostic cast, during surveying, we came to know that the different walls were not parallel, and they were not, the height of contour was very bulky, and we had to remove that. We had to remove some tori. After all these procedures are done, which are also called mouth preparations, the next then there is comes a point when there is a recording of final impression of that patient's arches, and from that final impression we get what we call is master cast. Master cast, this some purposes of this master cast is also then surveyed with the help of a surveyor, and there are different purposes of that too. Some of these purposes are same as that of the surveying of diagnostic cast, which is to select most suitable path of insertion after mouth preparations, to permit measurements of retentive areas, and to identify the location of clasp terminals in cervical third of tooth. Now this is, you understand that on the master cast you cannot do further changes in patient's mouth. All the changes have to be made or have to be introduced in cast partial denture that you are providing to the patient. To locate undesirable undercut areas that must be delineated or blocked out. Here you can see that undercut has been identified, and when this undercut, the amount of this undercut is too much, then some of the part is scraped from the cast. Factors affecting surveying, there are the so these are basically how which factors have to be kept in mind while surveying any cast, diagnostic or the master cast. These are the guide planes. The first step would be to make guide planes parallel to each other. Guide planes are basically those surfaces of the abutment teeth which will come into contact of the cast partial denture. They are the proximal surfaces. They can be a mesial or distal surfaces of abutments. Retentive areas, interferences and aesthetics. Guide planes are the two or more parallel axial surfaces, which are axial is what we call, which are vertical in nature of the abutment, which can be used to limit the path of insertion and improve the stability of these. Like this tooth, if you consider this as the distal tooth, so this is its mesial part, this will act as guide plane, and this tooth's distal wall will act as a guide plane. Proximal tooth surfaces which are parallel to each other must be found or must be created as guide planes. Either they are found or they can be created with the help of additive or subtractive procedures. They are necessary to ensure the passage of rigid parts of prosthesis into desired sitting area. Advantages of creating guiding plane are to give a direction to movement of prosthesis. Prosthesis easily removed and worn by the patient. No pressure on abutment teeth during contact, and no injury to underlying tissue. Also to ensure predictable clasp assembly function. Next step is the measurement of retentive areas where the extracoronal clasps will be provided. They must exist for a given path of placement, and they must be contacted by retentive clasp arms that are forced to flex over a convex surface during placement and removal. And for a clasp to be retentive, its path of escapement must be other than the path of removal of the prosthesis. Tension can be obtained by changing the path of placement to increase or decrease the angle of cervical convergence and alter the flexibility of arm. Third factor to increase interference. Interference may be of soft tissue, it can be bony or rot tooth related. Bony, like there can be any presence of tori. Must be eliminated by modifying of interfering tooth surfaces, alterations of tooth contacts with restorations, surgical removal or extraction. Aesthetics is also kept in mind by choosing most appropriate path of placement. The most aesthetic location of artificial teeth is made possible, and less metal and base material may be displayed. Less metal of retentive clasp is displayed if it is placed in distogingival area of the tooth surface. Quickly going through the procedure of surveying. First of all, we create guide planes, then create retentive areas, then there are identification and elimination of interferences, and then there is aesthetics. Now the the main concept that has been given to you, that these proximal surfaces have to be made parallel to each other. Diagnostics, alter cast and detour posteriorly until proximal surfaces are close to parallel relation to each other. When a choice is made between having contact with proximal area at the cervical area only or marginal region, the latter is preferred because a plane may be established just by contouring. Okay, quickly going through this uh, these procedure, because this is, as you can see, that this is the clinical procedure, and until unless you go through this procedure, you do it by hand, some things uh, will be made clear. So I hope that I will see you in dental clinics very soon, where we could actually perform this surveying on for a a patient. Creating retentive areas, they can be identified or created. Also, angle of cervical convergence is best observed between cervical blade and apical portion of tooth. Alter all the cast position by tilting it laterally until similar retentive areas exist. In areas of possible interferences in the mandible are bony prominences, lingually tilted premolars, and interferences are bilateral, then surgery or modification of enameler are advised. If interference is unilateral, a change in lateral tilt will avoid this. In the maxilla, there are the buccally inclined posterior teeth and bony areas in the buccal aspect of the edentulous ridges. Treatment options may be to provide relief, eliminate them, change the path of insertion, and restorations. In case of tooth undercut, we can block that undercut, we can recontour the enamel, thereby reducing the undercut magnitude. There can be a restoration, complete elimination, or changing the path of insertion. Areas of often overlooked are distal line angle of premolars and mesial line angle of molars. Aesthetics are basically, they are used when there are anterior teeth are being replaced. Path of placement must be chosen by keeping in mind the location of clasps and the arrangement of teeth. Gingivally placed clasp palms are aesthetically better, so we have to keep in mind that during surveying, the height of contour should be close to the gingival area of the tooth. Just a second. I think we are coming towards the end of the lecture. Let me see how many slides are remaining. Okay, so we were here. This app, I don't know why it keeps crashing down. Now survey line is, you can see that the height of contour is encircling the tooth. There can be a high survey line, there can be medium, there can be low survey line, and diagonal survey lines. Now at this stage you don't have to go into the details of the survey lines. I'm just trying to show you what is a survey line. This is the survey line, which is created by putting a cast in a dental surveyor. They can be medium survey lines. This is the height of contour or the survey line of that tooth. And see the diagonal survey lines. So this marks the end of today's lecture. Inshallah, we will be joining each other in dental clinics soon as well. So in meantime, keep your spirits high and cover as much topics as we have covered here in lectures. Please consult your textbooks as well. Some of the things that cannot be covered in this limited time of these lectures can be easily understood when you quickly go through your textbooks regarding those topics as well. Thank you so much.